Yeah, I'm sitting in a hotel room in California, so my background is very bland.
There's nothing wrong with being bland.
That is absolutely the truth. Okay, I make one faux pas very early in the morning in California.
I was waiting about 30 or 40 seconds for the live stream to configure, but I think we're there now. So good morning, everyone, and welcome to our commissioners meeting for the Judicial Commission on Mental Health. We're delighted to have you here today. We have a busy agenda, but hopefully we will be finished well before noon. And I want to make a few announcements. First, as you know, the legislature is about in the last 40 days or so of the 87th session. We have several, or the JCMH has several legislative proposals that have made their way into bills, and we want to thank the Texas Judicial Council, and in particular Senators Zaffirini and Huffman, and Representatives Moody and Leach for their leadership in working with all of the stakeholders that are interested in these issues to pass some effective legislation. So today we'll hear updates on those legislative proposals and information about JCMH projects and our committees, which in particular for those of you who have recently joined as new commissioners, will allow you to find out some information about our committees and hopefully then express an interest in joining one or more of them. Most of the work of the commission is done through our committees because obviously when we have these large commission meetings, it's more difficult for us to collaborate and problem solve. So that's going to be the way that we get our work done, and we're anxious to have you involved in that work and get your thoughts and your volunteer time to assist us with it. Finally, I want to offer our sincerest condolences to the family, colleagues, and friends of JCMH contributor Dr. Floyd Jennings. Many of you knew Dr. Jennings. He served as a Harris County Public Defender since its inception in January 2011. He held a PhD in psychology, was a long-term adjunct faculty member at the UT Medical School in Houston, I think called McGovern now, and went on to earn his JD from the University of Houston Law Center. He's the author of over 35 publications in mental health law. So as you can see, his work is really the work that we build on through our commission. He's the author of he also assisted as a contributor, and in particular, several commission members have worked with him. So a friend of Dr. Jennings encouraged us to let you all know about this news and to remember him as he would have wanted, energetic, compassionate, always learning. And so we're very grateful for his efforts on behalf of mental health and in particular his efforts for the commission. And with that, I'm going to now turn it over to Judge Hervey for our morning session.
Thank you, Justice Bland, and good morning to everyone. I appreciate all of you who are participating today. Hopefully it will not be much longer until we can actually gather in person. We will start this morning by recognizing our hardworking Collaborative Council. The Collaborative Council is comprised of judges, lawyers, law enforcement, advocates, agency leaders, and other stakeholders who advise on the projects and strategies undertaken by the Commission. The Council assists the Commission by sharing information about issues that affect judicial and court practices in cases involving persons with mental illness or intellectual and developmental disabilities. We will hear announcements from them later today. We also have 3 new Commission staff members, and I'd like to introduce them. And first, I'd like to introduce Willette Sedgwick. Willette joined us in the fall as part of our finance team. She's an accountant with over 12 years of experience working in state government. We are very lucky to have her working with us on the budget and grant proposals. Next, I want to introduce Dan Heron. Dan is our communications manager. He has over 20 years of experience in marketing, graphic design, social media, and public outreach in both public and private sectors. We are excited to add his experience and point of view to our team. Finally, Michael Sipes is our new legal assistant. Michael has 15 years of experience as a paralegal. He is an excellent addition to the team and will help us stay organized and well-informed. Now, please turn to your meeting notebook, and you should have what you have should have received via email. It is also available on the JCMH website, which is texasjcmh.gov. In tab 1 or page 4 of the PDF, you'll find the agenda. Our planned break is at 10:10, but please feel free to take breaks as you need them. Just come back because we want all of you to enjoy this meeting with us. And before we move on, we have announcements from commissioners. But first, we will hear from commissioners from key state agencies, and then we will have time to hear from commissioners who have announcements. Now I will turn to Christy Taylor, our Executive Director, for her report. Thank you.
Thank you, Judge Herbie, and good morning. If you all will look at your PDF of the notebook, behind tab 3 are our minutes from the last meeting. They have some highlights of the new commissioners and are really well done. Thank you to Michael Sipes. And so I hope that you'll let us know if there are any mistakes in those that we need to correct. Next, behind tab 4 is a copy of our strategic plan. The strategic plan was developed in 2018, and we sent it out for comment and received comment and made some adjustments and was ultimately approved by the executive committee and the entire commission. We have a new committee that you'll hear about later today for long-term planning. This committee, I think, will advise on when it is time to look at this strategic plan again and make adjustments to it. When you're looking it over, especially new commissioners, you might notice at the end of each strategy is a cite to where we found that original language. So a lot of it was from the order creating the commission. Some was from a survey of our commissioners in 2018 about what their priorities were. We had a planning committee that helped create the commission. And we also just looked to some other national resources and our executive committee to develop that strategic plan. So we are still focused on that plan. Behind the next tab on 5 is our budget. And you'll see how we have been spending our state appropriations to reach those goals. At this point, we have an imbalance estimated at $86,000 that may be reduced by some additional grants that we are offering before the end of this fiscal year. And Patrick Passmore will tell us about that in a minute. The next tab is a chart of the perceived effectiveness of JCMH projects. This was a survey that our commissioners from 2021 just completed. And the good news is that almost all of the, really all of the JCMH projects have very high perceived effectiveness. We start over on the left with our bench books and our summit. And even our projects that are on the other side of the chart still, as you see, have a very high approval rating. We think that possibly local grants and scholarships may have had a lower mark simply because not as many commissioners are familiar. And I wanted to point out that this that there is thinking behind the local grants, that even if it is just one community that's receiving funds for a program, our executive committee is very careful to ask those communities to create blueprints and to be thinking globally, to think about how the entire state can use that knowledge and learning. And we don't intend it just to benefit one small group. So you'll see some other things that you'll hear about in the future as we develop those long-term plans. But there are there's a statewide resource website that we're planning. We host roundtables on specific issues. And we also have trained some folks on being a facilitator and sim mapping. Some of you have gone through that. And I know HHSC through Dr. Jenny Simpson is also planning to train some more folks to increase that workforce to be able to go into communities and do that sort of one-on-one technical assistance to help them through mapping out what they have and what they don't have. Okay, so I'll move on to tab 7 is a document highlighting all of our committees. Justice Bland is going to talk to us and have some of those committee chairs give you some more information about the committees. And so I'll just take a minute to talk about our projects. We have put our projects in the next year into buckets of legislative, education, and grant projects. So under our legislative projects, we have several proposals from our Legislative Research Committee and our Senate Bill 362 Task Force that have made their ways into bills. And I don't think David Slayton is here yet. He might, I don't see David. Okay,
Sure.
Yes, here he is. Okay, great. David was able to make it. He is a very in-demand person right now. And so I'll turn over to David to give us a quick update on some of those bills.
Thanks, Christy. Good morning, everyone. Thanks for letting me give you a little bit of an update. I was just glancing at the House budget efforts yesterday to give you a little bit of an update, but let me start with the JCMH legislative recommendations. As I reported to you at your last meeting, the 11 commission recommendations from just the general legislative group there were 12 of them, but 11 of them are in House Bill 4212. That bill was voted out of the House Corrections Committee on April the 15th. It is headed to the Calendars Committee in the House, which is the step before it goes to the House floor. So we expect that to be heard soon on the House floor. There are about 3 weeks left until it must be heard on the House floor, else it dies. So we're obviously pushing to get that bill moving, but no reason to be alarmed yet. On the Senate side, with those recommendations, the Senate Criminal Justice Committee is where that bill was referred on the Senate side, and they are waiting for the House bill to come over before they hear that bill. So the House Bill 4212 is the key bill that is Representative Speaker Moody's bill. But again, we don't have any reason to believe there's any issues with that. The Omnibus Courts Creation Bill, which is filed every session by the chairs of the Senate Jurisprudence and House Judiciary and Civil Jurisprudence Committees, has a lot of things in it, but one of the things it has in it is the recommendation for the municipal and justice court, the fine-only pleas, and making sure that the person is competent when making those pleas. And both of those bills were voted out of committee this week. So on both the Senate and the House side. So that is also moving, and no reason to be alarmed about that one. On the emergency detention recommendations, those recommendations are contained in Senate Bill 1511 and House Bill 3977. We have run into some significant opposition with a number of those recommendations, especially in the Senate side. And the Senate State Affairs Committee is where that bill is referred. Senate Bill 1511 is referred. And that we've visited with them, and they have expressed concerns with expanding the list of medical professionals who can file an application for an emergency detention, and the seizure of firearm provisions. We continue to have conversations with them about those recommendations, as well as the other emergency detention recommendations, and we're trying to work through any opposition to those. And if we can get some consensus on either those recommendations or the others in the emergency detention bills, we are looking to add those on to House Bill 4212, which has all the other recommendations in it. So that is the update on your recommendations. And I'm sure others can give you even more information on this, but from a budget perspective, just the bottom line is both the House and the Senate have funded the Judicial Commission on Mental Health in their budgets going forward, which is good news. And that will continue. And that's good. That's exciting. So with that, I'm happy to answer any questions you have or turn it back over to Christy for continuation of the updates. Looks like Commissioner Maples has his hand up.
Thanks, David. On the 1511, is the opposition from members, or are there groups that are opposing it that you are aware of?
What I'm aware of is from members. There may be groups that are informing that opposition, but the members, it's the committee themselves. So Senator Hughes and his staff who've looked at them have expressed the concerns.
Thanks.
Any other questions? Thank you, David.
Thanks, Christy.
We really appreciate your effort.
David, before you hop off, I just want to express our incredible gratitude to you and Megan Lavoy, who have worked very long hours to advance this agenda. So when Representative Leach presented the bill to the Corrections Committee, David had been up all night on a bail reform issue that the Supreme Court is a resource on, not the Supreme Court, the Judicial Council. And despite that, he came to the hearing and helped. And it was interesting because the chair of the committee, Representative Murr, also had been up all night, but there they were, both fresh as daisies at 8 o'clock in the morning to hear our bill first thing. And I just want to thank you on behalf of all of us for the work that you're doing. And also to say that our Vice Chair, Justice Bill Boyce, just did an excellent presentation as a resource witness and did such a good job that the committee had no questions, and it made for a very easy morning for the JCMH. So thank you, David, and Christy, I'll turn it back to you.
Wonderful. Okay, moving on our education projects, we have the summit is starting up, and we received many proposals. So a lot of exciting work going on with that. You'll hear a little bit more in our committee reports. And I'll move on to our grant projects, as well as with our bench book projects are under education. So I'll move on to our grant projects, and we'll get a report from Patrick Passmore, our finance manager.
Good morning. Thank you, Christy. Just wanted to give everyone a quick update. The grantee program reports were presented at the last commission meeting, and they can all still be found in that notebook that was presented at that meeting. We currently have 11 grantees, most of whom grant awards were received in FY 2020, and they requested an extension of time to expend those funds through 2021 and complete the projects due to the COVID-19 pandemic. A lot of those programs were intended to be in-person trainings and collaborations that were just unable to be possible given the pandemic. So we're allowing them extra time to complete those projects. You might have noticed on the Commissioner's Effectiveness Survey graph that Christy mentioned that's in your notebook this time, that the local grants program, unfortunately, although it was very good and it was everything was highly rated, it was the lowest. And I'm going to attribute much of that to it being very local, supporting smaller communities, and the fact that many of these programs, we still have to see the results of the changes and the programs that they've implemented with those funds. Also, as mentioned, the budget document can be found in your notebook behind tab 5. You'll see that we currently have a project in balance, like Christy mentioned, of $86,670. With these remaining funds, we hope to extend our mental health technology grant initiative. We have advertised this opportunity earlier in the year and did not receive really the response that we were hoping to. We had 2 counties take us up on the opportunity, and at only $5,000 each. So we plan to reopen this application. I know that it's late in the fiscal year, but we want to advertise it better. We now have information on a grants webpage on the JCMH website, and we want to provide those additional opportunities to communities to invest some more in their technology going forward after the pandemic to continue operations as efficiently as possible. So as I mentioned, the application and guidelines for those technology grants and other opportunities can be found on the grants webpage on the JCMH website. If you go to the JCMH website, up in the top right corner, you click on that menu, grants is going to now show up as one of those pages. Finally, for this fiscal year, we are finalizing the request for applications for the community diversion coordinator, which Christy's going to provide some additional information on here shortly in this meeting. Final announcement for us is that fiscal year 22 grant applications will go live April 30th. And so those are going to be our general applications, and we'll send out some more communications regarding those grants and the application information through a JIR shortly in the near future. Christy, that's all I have for the grants, if there's no questions.
Great, thank you, Patrick. And I just want to reiterate that we have two different sets of grants going forward, that we will be doing a longer term for the next fiscal year for those projects that would take more time. But because we have these, the 86,000, we're doing a short-term technology grant that would need to be committed by September of this year. And it seems like there are a lot of projects that are using iPads, connecting courts to folks that don't want to travel from state hospital, and connecting courts with, I think, attorneys who can't come in. I think there have been a lot of great uses of that. And so if you will help spread the word on that, as Patrick mentioned, you can find that on our website. And also on our website, I forgot to mention, our staff has worked on legislative summaries. So if you want to see concise 1 to 3 page summaries of those bills that David talked about, at the very top of our website is a banner where you can find those. And they're also under resources for the 87th legislative session. And coming back to the community diversion coordinator that Patrick mentioned, this project, we just want to thank everyone. We've had a lot of advisors. We have a work group working on it, and then we realized we needed more probate judges, and we roped in Judge Kazin, we roped in Judge Carr. We wanted some criminal court advice, and Judge Jan came in and talked to us about. And so that request for application will be going out soon. We are in just the final stages. We have a job description, but for those who aren't familiar, it is going to be a pilot project where in 2 communities, the JCMH funds this coordinator, and we are hoping that they will help connect the local mental health authority and the courts, whatever is already there, improve on that situation, and specifically help with the process that hasn't really been used very much in Texas. We've heard Williamson County might be doing it, but using the part of the CCP where you can transfer criminal cases to probate court as a diversion technique. And we will have Williamson County, they have someone in this role, we'll have them advising, and HHSC is our partner in this project. Dr. Jenny Simpson is committed that they will provide technical assistance to those communities, bring in training, they will get a SIM mapping. So a lot of benefits, and there is a lot of interest in it. And so we're in the final stages of putting that out, and we'll be excited to see what's next with that. And then one final announcement under tab 8, you will find the Health and Human Services. This effort was led by Dr. Courtney Harvey, where painstakingly she had a work group that painstakingly went through every standard that they thought was appropriate for outpatient competency restoration. It was a multidisciplinary group. I know many of you served on that, but those standards have been published, and we just wanted to help spread the word by putting it in our notebook. And if you have questions about that, I would refer you to Dr. Harvey. And that is all for me and the business part of the meeting. And I think Justice Bland is going to talk to you about our committee structure.
So the executive committee, which is composed of Judge Hervey, me, Justice Boyce, David Slayton, Christy Taylor, and Judge John Specia, who's our jurist in residence. We meet regularly about 6 or 7 times a year, and we evaluate what is happening with each of our committees. From there, we sort of have developed some longstanding committees, and we've added a couple of new ones. So this year, for this meeting, we're going to ask each committee chair to give everyone an overview of the committee's mission, charter, and then sort of the work that they're doing and hope to complete this year and maybe over the next year, and to allow everybody to be informed about what we're doing, because not everybody serves on every committee. So it's nice to know what our colleagues are working on. And then also, if you are a new member and have not already been enlisted in some capacity on some committees, if you then have say, oh, that's the one that I would like to really work on, that's where I think my expertise would be very useful. That this is the opportunity to learn about those committees, and then reach out to Christy and her team afterward to let us know of your interest. So with that, I'll turn it over to Judge Camille DeBose, who is the chair of our bench book committee.
Thank you, Justice Bland. The bench book committee meets about 3 times a year. In spring and summer, we advise on the content of the bench book and also serve as editors. This year, we'll be working on the 3rd edition, which will contain a breakdown of the laws regarding insanity, as well as a section on re-entry. These books are a practical resource for judges and lawyers who handle these issues every day. If you have expertise in any of these areas and want to join us and are passionate about these areas, please email the JCMH staff, because we covet your advice and expertise. It really helps to make the bench book successful when people who have a passion for those areas give us their input. So Judge Cindy Wheelis, who is awesome, and as the chair of the Juvenile Bench Book Committee, was not able to be here today. So next is our JCMH staff attorney, Molly Davis, to give us the update. Thank you.
Thank you, Judge DeBose, and good morning, everyone. The Juvenile Bench Book Committee also meets 3 times in the spring and in the summer. Our focus this year will be on lack of responsibility and also on confinement in TJJD. If you have expertise in these areas or you want to recommend someone you think would be good for this committee, then please email the JCMH staff. It's jcmh@txcourts.gov. Next, I'd like to introduce Judge Brent Carr, who's the chair of the Summit Committee.
Thank you, Molly. Okay, so this year we've got the keys in the ignition. We're revving up the engine. If you have an interest in a topic or you have a particular good speaker that you're aware of, now is the time to get that information turned into the staff. As importantly, if there's something that you're passionate about, this is also a great time to offer up your service as a committee member. So we've had one little nucleus team meeting. We now want to put the full committee together and begin planning another blockbuster summit to whet your appetite. We've reviewed stuff such as a forecast of the future of mental health planning and treatment. We're going to continue with our IDD, include maybe a look at the spectrum. As you heard Christy mention, we want to maybe look at that AOT provision for utilization of probate courts. Our lived experience was well received last year. This is a big marketing time for our commission. and it was very well received. As you know, over 1,500 attendees last year. I think the approach this year is we're going to have a blend of remote and in-person participants. So any conference warriors out there who would like to join this effort, please contact the staff and we'll put you to work, by God. Thank you. I think Judge Boyce is next.
Thank you, Judge Carr. On behalf of the Legislative Committee, I want to encourage anyone who has interest to contact the staff if you wish to participate in the committee and you're not already doing so. The good news about this committee's work is that it never stops. As soon as one session ends, we will be resuming our meetings, looking at particular issues and broader approaches across multiple statutes and multiple areas that can be affected by legislative proposals. As David explained in his earlier report, we have a number of proposals that were unanimously approved by the Texas Judicial Council. We anticipate that there will be a continuing process of identifying legislative changes, proposing them, brainstorming them, bringing in stakeholders from a wide range of disciplines and perspectives. So if you do have interest in participating in this process, we will likely be resuming our meetings shortly after this current session is concluded. We'll take stock of where things are and we will start planning for the next one. With that, I'm going to turn it over to Judge Jan, who's going to discuss the Forms Committee.
Good morning, everybody. What we were doing with the Forms Committee was working to provide some standardized forms for use for emergency detention, temporary commitments, extended commitments, authorization to administer psychoactive medications, both in civil commitment process and for the forensic process coming through the 46B area, provide some standardization and guidance for 1622 magistration and related documents to secure those mental health interviews under that process, and to standardize the intellectual developmental disability long-term commitment paperwork, and then move into the actual 46B documents for the criminal proceedings. We were able to work to a consensus and provide two sets of forms for different jurisdictions to review and look at, providing two different layouts based on the experiences for the probate courts from around the state, but primarily with Travis and Denton County because of the differences in how those systems are implemented in those counties and our relationships with our surrounding counties, both being rural and then larger, like with Dallas and Tarrant and Bexar County. We thought our experiences, because both of our areas do kind of have that rural and municipal blend to it, or I should say large metropolitan area blend. So we hope we've created a packet of forms there that just about any jurisdiction in the state can use. We discussed the 46B forms at length, and while we were doing that, discovered that the District and County Attorneys Association had just published a book of those forms, and we were looking at those and kind of came to the consensus that those were pretty good. And I don't know where we left off, if we were going to be able to kind of pirate some of those or not. Christy, I know that was a discussion from several months ago. And our last round of paperwork we're moving into was that 46B piece, I believe was the last one we had left from our previous meeting. And our actual final report is due to the courts in August. And you'll have to excuse me. I don't know who's following me because I walked off the bench just in time to log in and do this. So I have.
Thank you, Judge Jan. And you'll be happy to know that we have gotten Michael Sipes, the new legal assistant, focused on this project, and he has started putting them all in the same format and working with Molly to put that all together. And so it's moving along really well. Okay.
I'll go ahead and take the
Judge
lateral.
Specia, you're up next.
David, I'm after you, Judge Jan. The next committee I want to talk about is the long-term planning committee, and this is a new undertaking by the commission. I'm actually excited about this because one, we've gotten the vote of confidence from the legislature to continue funding through the next biennium. We have established the commission with a charter and goals. We have a strategic plan, but this is the opportune time for us to look at what we've accomplished, what we haven't accomplished, where we want to go, take into account new things, new curveballs like the pandemic and various different things, and the new legislation. And so we will look back at our charter, look back at the orders from the courts, and then we're going to look forward creatively. The legislature provides a significant amount of funds for this commission, and we have an enormous amount of time resources being committed by professionals across the spectrum. But we need to be very strategic. Texas is a huge state and we have huge problems. We need to pick things we can work on, that we can make impacts on, and decide what we can do and what we can't do. So I'm excited to get this together. We'll probably start meeting in the summer. If you're interested in working on this, it's a little bit of a wonky work. Please contact the staff, and we will put together a group of people to intensely focus on the direction of the commission going into the future. So thank you very much, and I will pass it to my good friend, Dr. Connie Almeida.
Good morning. I have to apologize. I'm working from home and they're mowing my lawn. So I do apologize for a little bit of the background noise. Well, thank you, Judge Specia, and good morning to everyone. I am the chair of a newly formed data committee, and I know you're all excited about joining that and volunteering. But as you know, data and technology are critical to understanding what we are doing. So really looking at how we can come together and talk about, what types of information are available, how do we collect that data, meaningful data, and ability to use that data. A lot of this is around the work that several of us are doing around the Stepping Up initiative. I know there are several counties that have Stepping Up initiatives. So really working together to have a better understanding of how many people in the jail with serious mental illness, how many of those individuals get connected to services, recidivism rates, and really how do we improve the outcomes for people with mental illness. If you are interested in working with on this committee, please contact the staff. I will also be reaching out to several of you that I know are doing great work in this area and asking for volunteers. Very much needed and excited about facilitating this discussion. So I will turn it back to Justice Bland. Thank you.
All right, so you can see the robust amount of work that our committees do, and all in line with the 3 prongs of our mission, which to collaborate, educate, and lead. And we strive for every committee project to advance one of those goals, and also to make sure that because there's many worthy projects in the mental health space, but we're most interested in those projects that advance and improve mental illness, mental health challenges when they intersect with the justice system, beginning all the way with law enforcement through court appearances, and then eventually what happens on the other side of incarceration. So it's a very broad swath, but that's really our focus. So if you're thinking about projects that might be something that the commission would want to take on, remember that that intersection and keep that in mind. And then if you have projects that you're interested in, bring those to either any of the committee chairs that you heard from today or to the commission staff. And our best ideas, the idea for the data committee and the recognition that without good data, it's very difficult to measure improvements or lack thereof in this space. And so that really came from a presentation that Dr. Tony Fabello did last year. And, we're hoping to get more concrete scaffolding around the idea of collecting data and educating counties about how to do it, how to find the resources to do it, what data is the most important to collect, and that kind of thing. And that's just one example. I just also want to talk about how the commission is already developing a reputation for being a place where stakeholders from lots of different areas of mental health get together and hammer out solutions, whether they be legislative, education, whatever it is. And we're developing a reputation for being an honest broker in those arenas. And it's because of all the work that you do and picking apart each other's suggestions and focusing on where we have common ground and can make an improvement. I know that in the House bill, Representative Leach talked about it being 3 sessions worth of work, that this was the 3rd session and part of a long-term plan. And, one of the reasons that the legislature will have confidence in this group is if we do have participation of differing voices from across the spectrum. So we encourage we encourage debate, and that way, hopefully, we come up with solutions that that our stakeholders can get behind. And so with that, that's kind of a wrap up of the committee work, and just encourage you to get involved. We are supposed to take a break at this point, but Judge Hervey, I'm wondering if we go ahead, because we're a little bit ahead of schedule, and I thought maybe we could go ahead and do a couple of the reports before we break. What do you think?
That's fine. And I just wanted to say real simply, what Justice Bland said was very eloquent, but just as the old adage is true that there are no stupid questions, there are no ridiculous or stupid or silly ideas. All the ideas that people have and all the suggestions to help in all of these areas are respected and carefully considered. So please help us help the rest of the community. With that, now I want to thank both Kama Harris and Molly Davis for all their hard work. We introduced the new members, but these ladies have worked tirelessly as well, and I just wanted to thank them again for all their hard work. And now moving into agency updates, we are going to hear some very good reports, starting with the HHSC community report from Sonia Gaines.
Good morning, all. Glad to see everyone and hear all the exciting things that are going on with the committee work and so forth. I have a number of exciting things I want to share with you this morning. First of all, I want to let the group know, I don't think I mentioned this, but back in March of 2020, I was appointed to a national group through the Conference of Chief Justices and Conferences of State Court Administrators to establish a national task force to assist the state courts in their efforts to more effectively respond to the needs of the courts involved with individuals with serious mental illness. And so we've been working on a number of initiatives that I believe will be helpful on a national basis in terms of working with the courts in that regard. So I'll keep you all informed on some of the products and deliverables that we come up with. One of the first things I want to share with you is some of just a few updates on where things are legislatively at this moment with things that kind of work through HHSC. Real excited about a bill, Senate Bill 454, that is authored by Chair Colcourse, will allow us to continue some of our work that we've done with Senate Bill 633, where we have done quite a bit of planning across the state with our rural areas, particularly working with our local mental health authorities. We've also had some of the law enforcement has been involved in that, as well as the state hospitals. There was a plan that was published, back in December of 2020, and we've used that as a roadmap for some initiatives that they continue to work on. So we're really excited about, I'm calling this 633 Part 2. So we're really excited to continue some of that work as well. Also, House Bill 3088, and that one is authored by Chair Coleman. That bill will allow us to take a closer look at our matching grants. Many of you know we have several matching grants now, totaling a little over $100 million, including Senate Bill 292, which focused on individuals that are justice involved. And so this allows us to help, make those grants a little bit more consistent across all areas. Gives us an opportunity to improve our ability to fund some of the smaller rural counties to be able to compete for the grants with a lower match requirement. For example, 25% match is what is being proposed here for populations of less than 100,000. Also removes the restriction for our urban healthy community collaborative initiatives that are focused on homelessness. It allows them to continue to participate in to apply for future procurements. The way things are written currently in legislation, that basically things would end in 7 years. So we're really excited about that piece of legislation. And then lastly, in terms of legislation, House Bill 4571, authored by Rep. Tony Rose, will allow us to create a statewide intellectual and developmental disabilities coordinating council, very similar to the Behavioral Health Coordinating Council, which many of you know we've had great success with that. This group would also involve many of the same state agencies that work with individuals with IDD. This group would also develop an IDD strategic plan, which we're excited about that. We currently have a version of the IDD strategic plan that is in motion right now, and we're hopeful that we can get that published this year, but this creates an actual council, which we're very, very excited about. Next, just some brief things about the budget. So far, IDD BH base budget remains intact with the House and the Senate. That means that service levels will continue for IDD, mental health, substance use services remain at the 2020 and 21 levels. So we're very excited about that, given some of the forecasts, as we walked into session. We were grateful that nothing so far has been taken away from us. We also are seeing additional funding, both on the Senate side and the House side, that would allow us to maintain certain substance use rate increases that we received from last legislative session. I'm also very excited. One of the challenges that we've had since COVID is access to inpatient hospitalization, particularly at a community level. Many of you know at our state hospitals, we have a huge focus on the forensic population, but because of some of the adjustments that had to be made, it's been difficult across the entire state in terms of access to inpatient services. So I was very excited to see that both the House and the Senate have funding in there to the tune of $30 million for the biennium for inpatient community hospital beds. And then Senate Bill 1 includes substance use funding for pregnant women and women with children. And that would allow us, if the Senate agrees with that, that would allow us to continue some funding that we received last session. So very exciting. And the next thing I want to briefly mention, we were very fortunate. I know many of you have heard the buzz about some of the new federal funds that are coming our way. And the first bucket of funding that we received is what we're calling HR 133, or Coronavirus Response and Relief Supplemental Appropriation. And this funding is coming from SAMHSA. And on the mental health side, we have about $74 million. And on the substance use side, about $135 million. So this is where I'm going to tell you, it really has been wonderful that we have a very tight strategic plan that we've worked on prior to receiving these fundings, along with the work that we've done on Senate Bill 633. So when these dollars came, as many of you know, we have to respond pretty quickly. We already had some pretty good insight about what some of the challenge areas are. So I'm happy to say that some of the areas that we're going to focus on, first of all, we're going to invest about $70 million in addressing homelessness. Real excited about that. Several different initiatives that we're going to focus on there. We are looking at some step-down services for individuals that have had long-term state hospital stays and needing, a step-down solution once they leave those services. We're also going to be developing a homeless support hotline, similar to, we've had great success with the COVID support line. And so we'll be working with Tarrant County, the local mental health authority there. Really grateful for the work that they're going to do, as well as the development of a statewide web-based resource that will help people to gain access to more resources related to housing as well. We're also going to be focused on some rural crisis response and diversion in 8 of our rural serving centers, some jail diversion services, maybe some mental health deputy services. We've heard quite a bit of feedback from those areas about the need for those type of services. We're also going to, one of the things that we've been successful in part because of the support we've gotten from our legislature on continuing to expand outpatient mental health services. So we're going to continue that expansion along the line in terms of focusing on adults and children. That would allow us to mitigate wait lists. Today, those wait lists for children are at 0, and for adults, they're hovering around only 50. And many of you recall back in 2017 when the wait list was about 3,000 adults. So that's a tremendous opportunity for us to continue having that support. Also, we're going to be expanding coordinated specialty care, which focuses on young adults that have psychosis. For the very early psychosis for the first time. We've had lots of success with that program, and we'll be able to expand to some of the sites that have greater need, or some of the sites that we don't have at all. We're going to be doing some more peer services and enhancing our clubhouses and consumer operated programs. So we're very excited about that. And then on the substance use side, there's some really exciting initiatives along the lines of public awareness, community development, overdose prevention. We'll be working on a program for the first time, a medically assisted treatment program for alcohol and other substance use disorders. We'll also be expanding some of our SUD services to our certified community behavioral health centers And we're excited about that as well. We're getting a lot of national attention for the work we're doing in Texas around our CCBHCs. We'll be doing some virtual behavioral health, recovery support, and some housing initiatives in terms of recovery residents. So lots of exciting things happening with those federal funds. We also know that that's the first bucket of funding that we're getting. There's also some funding that will be available directly to our community mental health centers that they will be applying directly, but we'll be working very closely with them on the planning to make sure we're in lockstep in coordination. And then we're also expecting another application of funding called the American Rescue Plan Act. And there we should also be eligible for a little over $200 million. And we're hopeful that those funds will allow us to continue some of the things that we're getting started with the first two bucket of funding. And then the last thing I want to mention is that the work still continues on COVID relief efforts across the state. I want to thank all of our local mental health authorities for the work that they continue to do in providing crisis counseling services and supports. Thousands and thousands of people have been served across Texas. I also want to thank Harris Center, our local mental health authority, for the work that they've done on our COVID support line. Within a year's time, they've taken over 13,000 calls across Texas and help people to gain access to services. So lots of great things that are going on. I do want to mention that some of you have heard that the Biden administration has made a decision to rescind our 1115 waiver extension that we had gotten. And that I know that there are many people working very hard behind the scenes to try to figure out what's the next steps with that. That has a huge impact in terms of our mental health service delivery system. The funding there represents about 1/3 of our community mental health services. So we're, hopeful, and everyone's working really hard behind the scenes to look at, what are some of the options in terms of dealing with some of that challenge as well. So I know that's quite a bit of information in a very short period of time, but lots of great things happening on this horizon. Thank you all.
Thank you, Sonia, for that very interesting and thorough report. And now we'd like to hear from Mike Maples from HHSC State Hospital.
Judge, this is Brian Shannon. If I could, and sorry, Mike, if I could ask a quick question, maybe Sonia, you could share, or I see Lee Johnson and Beth Lawson too, that a lot of the public stories about the 1115 have talked in terms of aspects of the funding ending at the end of September 2022. But I think it's worth letting this group know that much of the mental health funding will end in September 2021. But if somebody who's more knowledgeable than me wants to elaborate.
And you're exactly right. The mental health funding is slated to end in September of this year. And for those of you that don't know, there's about a little over $300 million that is currently, funding quite a bit of our community mental health infrastructure today. So there's a lot, there's a lot to lose if there's not something that's put in place. Many of you know that we did receive notification, before the new administration came on board, that we had a 10-year extension on our 1115. So we were very, grateful and very optimistic about that. So now the tide has changed, and, it will definitely have a huge impact. I would like, Lee to chime in on, to give more perspective on that.
Yeah, no, I appreciate that, Sonia. I think you guys have done a great job of covering it. I think we're now in a circumstance where we're facing the cliff that the 1115 waiver extension addressed. And so now that the extension has been rescinded, all eyes are on, how do we pick the pieces back up and take the parts of the extension that were approved and, figure out how to make that work for the future. Of course, the waiver involves the entire hospital system in Texas. And of course, the two primary components of the waiver, the uncompensated care piece and the DSRIP component, the delivery system reform incentive payment programs. It's that DSRIP component that goes away, as Professor Shannon and Commissioner Gaines mentioned, September 30th of 2021. So that's less than 6 months away. So we're hopeful that state leaders are going to figure out how to continue this, figure out some way forward. But a lot of work, as Commissioner Gaines mentioned, a lot of work is happening behind the scenes right now. And I hope that we have some good news to present to the commission in the future.
Okay, thank you. Wow. Mike?
Yeah, hey, hopefully, that gets resolved quickly. I'm really kind of concerned about that as well, even though the hospitals don't, actually get any of that money. It's certainly a part of the system that supports what the hospital does, and very concerning to us as well. I wanted to just kind of update folks on a couple of tracks. As you know, kind of over the time we've met, there's kind of two themes that we've talked about. One being expanded capacity of the state hospital system, and the other being kind of the things we need to do to make more efficient use of that capacity. On the capacity side, kind of in the legislature, the good news is that the funding is in last night when the supplemental bill was passed. The money is in there to finish out at least on the House side, to finish the construction of the Austin State Hospital and San Antonio State Hospital, and also begin planning for a new hospital potentially in the Dallas area, which has always been a part of our plan, is looking where Dallas is the only urban city in the state of Texas that doesn't have a state hospital. And so that's been a part of our plan and discussions for a while. But in the House Bill 2, which is the supplemental bill that will be going to conference, there is money identified for that. In both budgets for the House and the Senate, we have had in play adding about 350 beds to the system. Through our added expanded capacity. Both have dollars identified. The Senate has about 10 million less than we were asking for. That equates to about 45 beds. But the rest is in Article 11. So I think in conference we'll get that resolved to some degree. The additional 40 beds that we had slotted for San Antonio is in the base bill and has been approved. In fact, we had the ribbon cutting for the opening of that unit last week. So those beds are coming online in San Antonio as well. So still looking at the 350 other beds in play that the legislature has constructed and funded. So I'm confident that since they invested the money to build them, that they're going to invest the money to operate them. So that will obviously be good news for the state hospital system. The other piece that I wanted to talk a little bit about too is some activity related to, having the expanded capacity is only a part of the picture. How we use that expanded capacity is another discussion point that we've had. We actually have a bill that is, Representative Price has a bill that helps with the more efficient use of our beds related to the compelling of med orders and the process that we have to go through for that for persons that are transferred from the IDD system to the state hospital system, to make sure that we can do that as expeditiously as possible, folks that need medications. So that will help. That bill also includes some provisions about doing some specialty care within the state supported living centers to try to avoid having to transfer folks that have significant psychiatric or behavioral needs over to the state hospital system. So that will help with making sure that our beds continue to be used most efficiently. House Bill 1824 by Price, which will be doing that. Some of the other things that we've been working on, I think last session or last meeting, actually, I gave you a study about, kind of estimates. How long should we be attempting to restore somebody to competence? And the science and the literature is starting to hone in kind of into this 18-month kind of window about where you optimize the time spent restoring people. And if you're going to be able to restore them, it'll probably likely happen within that time frame. We pulled some data and looked at that, and about 17% of the people we have in the hospital today have been there between 2 and 10 plus years on a 46B attempting to restore. So I think that's something for us to continue to talk and look at is, with our partners in the judiciary and with our local community partners and others, how long do we have people in the hospital under an attempt to try to restore competency? At some point, the question gets called at what do we do next if we really aren't going to be successful restoring them to competency? How long do we hold them in a certain type of bed or a bed? And what are some of our other options? As Sonia talked about working on step down options and other things. Are there other things that we need to work on and work with the judiciary and others about converting them to a civil and potentially stepping them down or doing some other kind of treatment approach? But that would free up, again, capacity to bring people off the waiting list, as we've got, almost 17% of our population in the forensic commitment area has been there for 2 to 10 plus years. I didn't look beyond that, but I think that's something for us to seriously continue to look at. One of the other data points, and I think we've made progress in this area, but we're continuing to work. Certainly, as Commissioner Gaines has talked about outpatient competency restoration and kind of how that expansion. We still have about 80 people on the waiting list that are misdemeanors, and really looking at, is that the best use of that? I know Shelley Smith has kind of been working too on initiating treatment in the jail for some folks and getting them diverted before they ever get into the hospital. We've done more and more of that with other hospitals, especially of folks that are more actively psychotic. How can we start medications? Or there's some things we can do to get them to a level that they can either divert to outpatient, or some folks we've been able to get to, no longer being incompetent before they've come on to the waiting list. So trying to work very closely with different strategies to do that, knowing that we've still got a ways to go on the waiting list. Certainly COVID is we were on our downward trend on that waiting list before COVID hit, and that kind of threw us. We had to take a number of beds offline. I've gotten about 200 beds that we took offline because of COVID back online. So we're still not back at full capacity. COVID aside, we've got other issues, but we're working very hard to get those beds, as many as we can, back online as quickly as we can, so that, again, we're firing on all cylinders. But I think part of that other piece of this discussion needs to be that efficient use. What is the best use of those beds and decisions that we've made about those beds? Still, our overall capacity, about 800 people, including civils and the ones I mentioned that have been there a really, really long time. And so really looking at housing options and step down options and other things, so that we're able to take people that are most critical, whether civil or forensics, into the system right away, and not be kind of the de facto housing program for some folks. So that's I think about the extent of my update. Very excited, like I said, even in a challenging legislative session, still committed. The legislature still being committed to moving us forward and actually looking to the future, and potentially, like I said, even a new hospital potentially in Dallas. So we'll see how that goes as we enter into the conference discussions. The Senate and the House still have to kind of come to a meeting of the minds on the budget, but I think it's all been very positive up to this point, as Commissioner Gaines also pointed out. But I think I'll stop there on our update.
Well, thank you very much. And I think now, if Justice Bland agrees, we will take a 5-minute break and then we will resume with some other reports. So please be back at 10:16. Thank you very much.
Okay, Jenna, will you take the break slide down, please? Thank you.
Okay. Now we will hear from the Texas Juvenile Justice Department, Sean Grove, who's the TJJD Chief of Staff for Camille Kane.
Thank you, Judge. Good morning, everybody. Sean Grove, Chief of Staff for TJJD, filling in for our Executive Director and Commissioner Camille Kane. Thank you, everyone. Before I get started, I do want to just stress how much we appreciate our state partners, in particular HHSC. And I know one of the conversations that we just had was around state hospital beds. And I can't tell y'all how invaluable it is for us to be able to pick up the phone and call HHSC and immediately start staffing a youth who is in active crisis. Now, I know we all wish that there was more beds available, but having that ability to staff between two different agencies and look at what's best for this child right now who's in active crisis is really amazing. And I know that as we continue to grow in our partnership and resource availability, that will only get better. I'm gonna stick to my notes, or try to at least. I think it's been a while since we gave a full agency update, at least pre-COVID, which I know, at least for us, feels like 20 years ago. But some of this is gonna be information that we've already discussed. So in 2019, we began what we call the Texas model, which is really how we see the next steps in reform for the Texas juvenile justice system. And we're focusing on identifying the specific mental health needs for the youth to provide adequate treatment for those needs. And so one of those things, and I know that we discussed, I believe in 2019, in 2020, was an emphasis on the adverse childhood experiences so that we can accurately document these childhood trauma. So in brief, there's 10 adverse childhood experiences, and we assess those through a variety of means, through the PACT and through a specific questionnaire that's provided, so that we can assess what's the state of the youth when they're coming to us. The CDC estimates that about 12.6% of the population has 4 or more ACEs, and that's when it really starts getting scary. For our population, about 86% of our girls and 53% of our boys have 4 or more of these 10 adverse childhood experiences. In terms of the general mental health, the population of the youth at TJJD has steadily decreased, as we know, through the reform efforts by the legislature and by the system over the last 15 years. But during that time, the percentage of the youth with intense mental health needs has increased. So in 2014, about 21% of the youth who came through our intake and orientation and assessment unit were identified with significant mental health needs. In 2020, that was 60% of our youth. With the improvements on how we identify on not only the mental health needs, but also the adverse childhood experiences, we've made significant progress on the provision of these treatment services to the youth. So we have continued building on the implementation of trauma-informed methodologies, such as the trust-based relational intervention, by developing curriculum and training staff. This past March 2021, over 100 of our staff were engaged in this TBRI practitioner training. And we also extended this opportunity to our county partners to try to provide still those wraparound services, continuity of care within the juvenile justice system. We have transitioned away from these dorm based treatment options, right? So historically in TJJD, you would go from the say capital offender dorm, and then you would go to the drug offender dorm, and that would be how you would go through treatment. But that's not how we do schools, right? You don't have a math dorm and then you're done with math and you go to an English dorm and then you go to a history dorm. And so we really wanted to focus on this concurrent treatment and not consecutive treatment. And so by building through this integrated treatment method where youth can participate in pull-out treatment groups, allowing them to stay in their dorms with more stable population on their dorms and more stable dorm assignments for our coaches, we can build those healthy, appropriate relationships to try to continue to engage with the youth and as we say in the Texas model and also with TBRI, catch these incidents low, right? Before our youth become so dysregulated that assaults occur, violence occur, and people could be injured. And this has really improved our positive connection with the peer staff and the youth. We've introduced a new classification system to most effectively utilize our campuses until we are able to move into smaller, more stabilized facilities. And that's what we see as a big step forward. I think gone are the days of sweeping reforms for the juvenile justice system. When 2007 through 2011 to now, what we need now is to really get out of this decades old mindset of large institutional facilities where you house 200 youth in this highly correctional setting. We can provide security in a correctional setting in more manageable milieux, smaller populations, to really help be targeted for the youth that we have. And so within this classification system, this includes moving our mental health treatment program to the Giddings facility, which is in Giddings, Texas, just about an hour east on 290 from Austin, to be able to hopefully pull into those resources from the Austin area. The Giddings facility also houses now our crisis stabilization unit for your youth that are in present crisis, requiring highly acute treatment and enhanced supervision. We continue to use the Willoughby House in Fort Worth for our most vulnerable youth, including those with high mental health treatment needs, intellectual disability impairments, among other vulnerabilities. And this is our primary step-down facility, non-secure halfway house for the youth through community reintegration efforts. And we can provide these services for the most vulnerable youth, and that's in Fort Worth. We have created an enterprise level method for tracking youth on suicide alert, monitoring how long they've been on increased alert status to better meet the needs and ensure their physical safety of the youth. Additionally, very recently, we have started utilizing the neurosequential model of therapeutics assessment, which helps identify youth's neurological development history and offers specific recommendations on how best to reach the youth in terms of treatment. And what this really does is helps ensure that the specialized treatment is offered by the agency in the most effective chronological order to address associated risks. Regionalization and coordination with local departments remains at the heart and prime focus for the agency. We know that the vast majority, 95, 96, 97% of the youth in the juvenile justice system will never come to TJJD. They are treated at the county level, either in residential facilities or active probation. And so providing these resources is really at the heart of what we do in expanding resources for our county partners to continue to be able to treat the youth low in the system, closer to home, is a priority for the legislature. It's a priority for our agency. And so grant opportunities provided to probation departments have been allocated for broadly recognized practices, such as the positive achievement change tool, that PACT assessment I mentioned, evidence-based practices and community supervision, EPICS, and Kids at Hope programs. Trauma-informed approaches like the dialectical behavior therapy, trauma-focused cognitive behavioral therapy, and the trust-based relational interventions. And commitment diversion placements through the regional diversion alternatives programs. While these approaches highlight some of the tangible progress that we have continued to be able to build upon in the last several years, more work is definitely needed, right? I think that's at the core of this commission, right? So importantly, I want to highlight some of the innovations in assessing needs and treatment has made evident that there's a very small percentage of the population with complex, highly severe mental health issues coupled by extremely violent behavior. And they're simply just not being addressed by any existing paradigm of care in the state, including the state hospital, because often these youth are extremely violent when they go into placements. And so expanding resources and having the conversation about that population of youth, separate from the conversation of whether they are truly best served in the juvenile justice or criminal justice system, is really a priority for us moving forward, and something that we hope to continue to build on with our Commission on Mental Health. And then creating a system of education, collaboration, and treatment for these individuals presents a notable challenge. Youth who come into TJJD are historically about 4 grades behind average when they come to us. And so continuing collaboration with the TEA, continuing collaboration at the points of reentry with the local school districts to ensure that the youth are able to progress in their education and hopefully, as we know, as you're progressing in your education, you're progressing in your treatment, ability to regulate your behaviors and emotions, hopefully prevent future victimization, right? Prevent recidivism and allow these youths to continue to engage in society when they're able to reenter. And like most of y'all, and we have discussed earlier, we are tracking pending legislation during this legislative process. There are several bills that would impact the juvenile justice system, primarily at the probation level this session. And so we continue to provide resources for our county partners as well as the legislature on what those impacts actually would be. And we're monitoring the budget as everyone is. In the spring and the fall, we had issued our plan of reform, which we really do see as the next several steps on where we can take the sweeping reforms over the last decade or so and make this juvenile justice system the system that it should be and the system that it can be in the state of Texas. And so if we have not already provided that, if our team has not provided that to the commission, we'll be happy to get that out. And in that reform plan includes things that I've mentioned. It's the assessments, it's the probation resources, it's these smaller secure facilities where we can have more manageable milieus. And primarily the two things that we're focused on through the remainder of the budget cycle this session are continuing funding for our body-worn cameras, which has proven to be a tangible net gain in our safety and security measures at our secure and halfway house facilities, as well as continuing funding for that risk and needs assessment. So statute says that county probation departments and courts must consider this risk and needs assessment. Historically, we've been able to fund that through state cost savings, and in the austere environment that we find ourselves in right now, it really is necessary to be able to fund that at the state level for all counties to be able to use a validated tool to assess the risk and needs of the youth and place them properly in the system based on those risks and needs. That's the end of my notes. I'm happy to answer any questions from y'all, and thank you so much.
Yeah. Can I ask a quick question?
Yes, ma'am.
Great, thank you. Well, I love to see the attention to the wraparound supports. I have a couple of questions. So, we talk a lot about that, the need of wraparound supports to address these adversities, social determinants of health. So are you actually collecting data on that about what wraparound supports are being provided and what needs they're addressing?
Yes, ma'am. And if there's more specific, we're very data focused. So if there's a more specific question, I'd be happy in the next commission meeting or even in the interim to meet with you.
Yeah, and I can email you on that. Because again, it's such an important piece of the system and of the puzzle, but it's usually, we talk a lot about it, we put very little money and attention into it. So compared to other things. So I think eventually we need to really increase the funding for those wraparound supports and the accountability of what we need around wraparound supports. And the other thing too is I serve on the advisory council for DFPS. So youth that are involved in both systems, what special attention is maybe being given to that population? That's always been one of our highest risks, multi-system involvement. And I'm talking specifically about CPS and juvenile.
Yes. So in fact, we had several of our staff members participate in the Children's Commission dual status meetings that have been going on for the last several years. And so that really is a point, right? We talk about the youth who have these adverse childhood experiences, right? And the youth that come to us with intense mental health needs. And I can pull out the presentation that I had provided to the Children's Commission 2019 and provided this commission as well. But it's starking when you look at the breakdown between the youth that come to TJJD outside of the DFPS system and those that come to TJJD and have had interactions with DFPS. ACEs explode, right? Even the higher ACEs that we have, they're so much higher. And so the focus for us, particularly in those meetings and ongoing discussions with our partners at DFPS, are properly identifying those youth, right? I think that, and that was a big push that we had, particularly in the definitions. And I think that there are some members here, I think I saw Judge Betancourt, that were on those meetings as well. And so step one is properly identifying those kids, right? Because sometimes they come to us and they're on a status with DFPS, but sometimes they come to us and the case has been closed with DFPS, and that communication needs to start there. We always talk about reentry begins at intake, and for that to truly happen, we need to know the makeup of the youth when they're coming to us in intake so that we can work on these reentry services. These are conversations that, oh shoot, I mean, I could hijack this entire meeting and talk hours on this. I think that maybe in additional groups, depending on what the commission or emails, all of y'all are free to email me any questions. I'll be happy to bring additional information back to our next meeting. My emails is just like any other state agencies. It's just my first dot last name at tjjd.texas.gov. And in particular, you had mentioned before we went to the DFPS youth, these wraparound services. And so one of the efforts that we're really trying to engage in here is, 15 years ago, right? TYC, TJPC, right? Two entities that worked together, but separately. And so we want to make sure not only at the point of reentry that we're having these wraparound services, but that we're also not furthering divide any archaic TYC, TJPC relationships, right? And so having our parole officers engage with our program administrators on the county sides with those counties to provide the information. And it's not just probation, TJJD, reentry. It really is the system as a whole and what we can do at the point of reentry for these youth and providing the resources.
Thank you. Now we will hear from the Texas Corrections Office on offenders with medical or mental health impairments from April Zamora.
Good morning. I have just a few updates. We've been watching actually only a couple of bills, and really as it relates to reentry, generally speaking, and those will encompass mental health. One of those just passed the House, and it's House Bill 1045. Tacoma has oversight of the wrongfully imprisoned program. So Representative Anchia Parker sponsored a bill that would allow those that are wrongfully imprisoned to be able to add their spouses and dependents on state-sponsored employee benefits. So I think that's a positive move because a lot of those that are wrongfully imprisoned do come through services that are reentry in nature, and they haven't been able to access that plan because being able to add their spouses and their dependents was not an option. So hopefully that will pass on to the next chamber and we will be able to assist them. One of the things that they talked about in the committee hearing was the need for ongoing mental health support and treatment. And they did talk about their children and being able to access ongoing care and treatment. So we'll continue to watch that bill and aid them in applying for healthcare and mental health care. One of the things that we have been diving into over the last couple of weeks is looking at how we've been able to use telehealth within our Tacoma programs over the COVID pandemic. So we've been talking to our contractors, which we contract with every local mental health authority across the state. So they have come up with some very good telehealth plans. And so we have been issuing funding recommendations to them and adding to their budgets where we have funding available. And so many of them are going through the process of purchasing either tablets or smaller laptops where they'll be able to actually get out into the community and do more community work as we move forward through the next budget cycles. So I'm very excited. El Paso being one of the most innovative through emergence care, where they're going to a complete tablet system and being able to do a lot of on-site work with our probation and parole community. So that was a very innovative thought process that they came up with, but also being able to work with the local county jail where they will go in with tablets. Also working with Cass County to be able to do a tablet program, and then also looking at telehealth and being able to assist the jail out there. in that vein, there are a lot of proposals on the table from several LMHAs, so we'll continue to work through that process to support telehealth infrastructure through the Tacoma programs that are serving those that are justice involved. We also have some programs within our prison system. As many of you may have heard me talk about before, the Texas Correctional Office on Offenders with Medical or Mental Impairments sits within the Reentry and Integration Division with the Texas Department of Criminal Justice. So we have shifted some of our treatment reentry programs under the Reentry Division. So we have a Strive Women's program. One of the things that we know about that program, it is a women's reentry program. And what we found within that women's reentry program is many of the women did have some mental health diagnoses. So it did get shifted to our division. So we are working with those women on preemptively addressing trauma-informed care, talking about how they will come back out into the community, pre-engaging them with the LMHA before they get out so they know who they will be visiting with, trying to work with their family preemptively, working on any parenting classes they need to be able to re-engage with their children. So I'm really excited as that program rolls out within this division. One of the things that we're most excited about is we will be opening a veterans dorm, and we will be addressing issues and matters related to post-traumatic stress disorder. Many of our veterans are coming in, and we are definitely addressing substance use disorders, but we really want to get at the heart of dealing with any mental health issues that they're having. So within the Reentry and Integration Division, we will be opening a prison-based reentry dorm. We have one for our state jail system, but we will be opening a dorm at the Cofield unit for those that will be reintegrating within the next 120 days back into the community that are within our prison system. So I'm really excited. So hopefully that dorm will open mid-May, and that will be a collaborative effort between many of our divisions within the Texas Department of Criminal Justice. Two more things. We're working to partner with the Judicial Advisory Council that's within our CJAD, which is our probation arm of TDCJ, to roll out a training for our mental health initiative officers. Those are officers within the probation community that oversee those that are on special needs caseloads and partner with community local mental health authorities that are receiving Tacoma funds to create a specialized training for those officers. Talk to them about how to do crisis intervention, look at getting mental health first aid, training out to them. So as we work through that, hopefully we'll see some good results. Within the parole community, the recidivism rate is about 10.9% on a Tacoma caseload. So we're hoping to reduce that within the probation community. They're running at about 20% on the last study. And the very last thing is we have a chair over the Tacoma Advisory Committee. It is Judge Rob Canalato out of Tarrant County. He issued a recommendation for a juvenile subcommittee of our Tacoma Advisory. He appointed some gubernatorial appointees from our advisory committee, Judge Roger Rodriguez, Casey O'Neill, and Denise Onken. On there is also some state agency representatives, Marquise Butler, Susan Palacios, and then Liz Person and Jenny Simpson. So we're going over all of our juvenile policies to ensure that we're adequately addressing what we do within our juvenile realm. Some of the initial recommendations actually follow in line with some of the things that we're hearing from the commission. Really, we're looking at how can we use Tacoma funds better. What collaborative efforts can we do to make sure we're not duplicating what others are doing throughout the state? And then one of the things that we had questions about as we continued to discuss it is what educational things does Tacoma need to do to inform the judiciary about what type of services can we truly provide within the Tacoma program, because we found that a lot of youth were entering the Tacoma funded programs after perhaps they've had many falters on probation and we're struggling. So that is where we are in the Tacoma world. I hope I didn't talk too fast, but I get excited and sometimes don't slow down. So I will raise my hand and get into the committees because I get excited. So Justice Bland, I heard that call if you get excited. So I will be that person. With that, I will take any questions.
I have one. First and foremost, I'm like you. I do get excited about Tacoma services as well, and I do agree. And I guess something more we need to look into is properly maybe training or providing probation department in regards to utilizing Tacoma at the beginning of a juvenile's case, not as a option to keep them from going into placement or as a last resort. I feel a lot of times we are reactive instead of preventative. And I think Tacoma would be utilized so much, and it should be utilized. It would be utilized very well if it was at the onset of a child's first coming into the system. And therefore, once those services may not help or does not change the child's behavior and the child seems to continue to reoffend, then at that point, we're looking at a possible placement where there's more intensive treatment. So I do think that's something that needs to be very much stressed across the state, because Tacoma is a great, the services are amazing. We utilize them as much, but I get frustration when we need to do them in the beginning than at the end. And then also, I'm not too sure, but is there also a criteria for those children that are going into Tacoma that would be considered under Tacoma? And when I say criteria, I think just a more specialized criteria, because again, I think on our end, on the probation end, they can't provide that. They just say it's kind of, it judges someone who is diagnosed with a mental health diagnosis. That's just kind of the general that they give me.
I think that's what this committee was trying to get to the heart of, because really all of our probation referrals come direct from the probation department. And so at one point in time, it was judicial discretion plus a mental health evaluation. And so that has changed over time. And Mr. Grove, I appreciated his point to the divide between two agencies becoming one. And so that was really the point of this subcommittee, is now we all need to come back to the table as two agencies became one. So I loved that the representation from both sides of the house are on this subcommittee, if you will, the community arm and then that almost reentry parole arm. But one of the things that we do know is that the committee immediately saw if we had that placement at the very beginning, because it truly is a probation referral to Tacoma and then the assessment. And that is what gets them there when you talk about justice involved youth. So that's probably why your probation staff is having some difficulties giving you how to get in, because it is a probation referral. So we're trying to shore that up with working with our partners over at JJD, is how can we assist in giving some clear defining rules or ways to get in.
Thank you.
Thank you very much. And now we will hear from the Texas Police Chiefs Association, Chief Stan Gridge.
Good morning. I'll be brief. Start with an update of Senate Bill 64. Senate Bill 64 was filed by Senator Huffman. It was passed out of the Senate and referred to the Homeland Security and Public Safety on April 7th. So we are still waiting. We will work with Chairman White. Just to jog everybody's memory, this would establish the first statewide Texas first responder peer network, and they would create 6 hubs to provide peer intervention services for all Texas peace officers. We, within the Texas Police Chiefs Association, continue to focus on closing the metaphorical front door, because regardless of how good you all get on the back end, if we keep the front door open, we're just going to continue to add to your judicial plate. So we are trying to do that by adding layers of mental health clinicians in 911 centers. If we can't have the actual clinician in the center, then we are trying to do it through MOUs wherein we can divert calls of crisis to a crisis intervention service and do a warm handoff as it relates to that 911 call. We are also doing that by promulgating the best practice of MD RTs, multidisciplinary response teams. We believe that the best Texas model is inclusive of single units that are comprised of a peace officer, a paramedic, and then a licensed mental health clinician in the same vehicle, so that when they are not responding to crisis calls, they are actually working to prevent crisis. So they're going upstream to ensure clients are remaining on their medicines to prevent crisis and to prevent the actual 911 calls. So we're trying to do that through the MDRTs. Also point out, there's been a lot of discussion about emergency detentions. Some of the issues that we continue to face, hospitals remain on diversion. There's been a lot of discussion on that. So your peace officers are commuting great distances. Hospitals are also requiring medical clearances before receiving patients for inpatient. That's contrary to a Texas AG opinion, but we just can't seem to overcome that hurdle. And consequently, you all as taxpayers are consuming an inordinate amount of time where your Texas peace officers are in emergency rooms doing medical clearances before taking the person to receive inpatient treatment. And then one of the things that there's just simply not enough dialogue about, all right, is the co-occurring mental health with substance use. In housing, as it relates to homeless, we use the housing first model, where it's a belief that we can get them housed and then we worry about any mental health or substance use orders. So it's an order of treatment. That does not exist in the mental health realm, at least on the front end. Instead, when we respond, if there's a mental health concern and a co-occurring substance use disorder, folks, if that person has a 0.1 or 0.10 or higher, we're pretty much dead in the water until ultimately we can get their BAC down. And so what does that mean? That translates to your peace officers are literally babysitting clients until they can sober up before we address the mental health concerns. So my encouragement to this commission would be, we really need a best path forward, a better pathway to adopt more of a housing first mentality related to mental health. And then lastly, one of the biggest issues that, especially with my association with the Texas Police Chiefs Association, has been comprehensive police reform. And what does that look like? And yes, there is a direct nexus between police reform and mental health. So we are pushing for the mandated participation in the National Use of Force database. We believe that's a good thing. We also want to develop national standards for discipline and termination of officers. We also want to mandate participation in a national peace officer decertification database. And then this one is a big one. We want to enhance our ability to implement effective discipline. It probably would not shock most of you all to learn that probably more than 70% of all peace officers that we fire or indefinitely suspend are reemployed by another agency within 3 to 6 months. And so if we are serious about comprehensive police reform and ultimately protecting all citizens, then we need to move the dialogue away exclusively from just qualified immunity, which, by the way, all of us on this screen probably have qualified immunity, if not absolute immunity. But it seems like we've focused our national attention on qualified immunity and not on some of these issues that may have a substantive impact. So with that, we are busy. Thank you.
Thank you, everyone, for those important updates. It's so important that we are aware of the various initiatives that our large state agencies are involved in, and also the struggles that they're having, so that perhaps we can assist them in any way possible. So thank you again. Next, we're going to hear announcements from our commissioners. it's important that we all understand that, time is of the essence here. And so please remember that, a 1-minute update would be good. And if you don't have an update, just say hello. And please mute your microphones until I call your name in alphabetical order. And I will apologize up front if I mispronounce your name. But if I do, just understand that my last name is Hervey and no one ever gets it right. It's always Harvey. So please bear with me. So I'm going to start with our Vice Chair, the Honorable Bill Boyce.
I have no additional updates beyond what we've already discussed.
Oh, you did that in under a minute. That was wonderful. Thank you. Now, Dr. Connie Almeida.
I ditto that. I already talked about the data committee and excited about that opportunity to check. So that's my big update. Thank you so much.
Thank you. The Honorable Corey Carlisle.
Good morning. Great to see everybody. This has just been another very informative meeting. So thank all of y'all.
The Honorable Brent Carr.
Yes, I'm putting my email in the chat locally in Tarrant County. With the grant funding, we're starting a project on creating a community trauma-informed dashboard. So if anyone out there has something similar to that already going on, I don't like blazing new trails. So if you have something like that, if you could shoot me an email so I can get back with you and discuss. But other than that, it's always a pleasure to serve. Thank you.
Thank you. Judge Dominguez from El Paso had to jump off. He had some docket stuff to do, some judge work. So we'll hear from him next time. Honorable Camille DuBose.
Hi, and I really have nothing to add other than we're having a specialty court graduation next Tuesday, and I just want you all to know that I see the direct results of the work that these various committees do and the impact that it has on individuals that come before me. You change lives, and that's the best thing ever.
Wonderful. Dr. Melissa Eshelman.
I am pleased to be here. Got lots of great information and no information or updates.
Thank you. David Evans.
Thank you. Appreciate today's meeting. Connie has already messaged me to join the data committee. I'll coordinate with staff, but it looks like I'm being pulled in that direction. Thank you.
Great. Dr. Tony Fabello. No Tony. Okay. Elise Ferguson.
Good morning. I don't have anything to add.
Thank you. Kevin Garrett.
Good morning, everyone. I don't really have any updates, but it's been a really informative meeting. And thank you, Chairman Boyce, for allowing me to participate on the Legislative Research Committee again. Thanks.
Thank you. Dr. Courtney, now her name is Harvey. Dr. Harvey.
Thank you. I just have a few updates. I want to be sure that people are aware that HHSC last fall, in August actually, updated the data exchange process that HHSC has with the Department of Public Safety for the continuity of care query. Many of you know when an individual is booked into a county jail, a continuity of care query is initiated that allows for a 3-year look back to be done to see if that individual has ever received services in a state hospital, community mental health services provided through the local mental health authority, as well as our private psychiatric beds. And so this has come up as an issue in previous Judicial Commission on Mental Health meetings, whereby that data exchange was not capturing individuals who have an intellectual and developmental disability. So last year, we were able to update that data exchange process process to include capturing individuals with intellectual and developmental disabilities. So we're very pleased about that. We believe that, that population requires a different level of services and supports than those that have mental health or behavioral health needs. And so we want to be able to identify those individuals and provide them with the targeted services and supports that they need. Another matter that came up in the last Judicial Commission on Mental Health meeting is the 988 planning grant. Many of you know that last year there was federal legislation authorizing 988 as the 3-digit code to replace the 1-800 number for the National Suicide Prevention Lifeline. And there's been much fervor around how we as a state will implement that 988 phone number and how that is going to align with our existing crisis hotline infrastructure that is in place through the local mental health authority. So HHSC received more than $180,000 from Vibrant Emotional Health, which is a nonprofit administrator of the National Suicide Prevention Lifeline, that is going to allow us to do some planning on implementation of the 988 phone number, which has to be implemented by July 2022. So we're going to use those funds to help our centers develop the infrastructure that they need in terms of hiring FTEs, purchasing headsets and computers, training, and of course, educating their staff on this new process, as well as a data collection. And then lastly, forensic strategic plan. I want to give a nod to that. HHSC, through Dr. Jenny Simpson, the agency's forensic director, is partnering with the statewide Behavioral Health Coordinating Council and several other diverse stakeholder groups to implement the state's first forensic strategic plan. Strategic planning sessions were held with the statewide Behavioral Health Coordinating Council last fall. As you all have heard throughout this meeting, the statewide sequential intercept model mapping summit that happened in January. Many of you participated in that effort. That was an opportunity for us to collect data that is going to inform the content of that plan. And so activities are going to continue over the spring and summer, and we are hoping that by fall, that plan will be executed and distributed publicly. That concludes my announcements.
Thank you, Doctor. Well, she could be a doctor if she wants. The Honorable Bonnie Hillams.
Medical school's not on my, but anyway, I'm a little busy right now. But I just finished with doing about 2.5 months of sitting on a, excuse me, the Child Protective Court in Harris County for one of my mentees who just had a baby. And she said, can you take it over? And I got to do my drug court again and everything, which was great fun. But in the process of doing all of that, I am just even more acutely aware of trauma and the effect that it has on these kids that have had 30 and 40 placements in CPS. And each time they get removed. And so anyway, I'm hot on working on trauma stuff. And I'm also very involved in helping to fight with different programs, fighting sex trafficking, because it's a huge problem. And anyway, so that's my updates.
Thank you. And now we have Honorable Yolanda Huff. Oh, okay.
I'm sorry. Sorry.
I'm sorry.
Okay. Good morning, everyone. I didn't attend the last meeting. I was in Yosemite National Park with my family for spring break, but I'm glad to be here today. I am Judge Yolanda Huff. I preside over County Court 12 in the Mental Health Court in San Antonio, Bexar County. I've heard just so much good information today. One of my big things is taking the bench is just trying to educate the public on what the judiciary does in regard to mental health. I've done a lot of seminars and listening to all the great information today. I can tell you right now that there are several committees that are already in my mind are committed that I really do want to join. So thanks again. I'm really excited and just grateful and honored to be invited to serve on this commission.
Thank you. And we're honored to have you. Okay, Doctor, I keep calling everybody doctor. I'm the Honorable Dave Jan.
Yeah, Justice Hervey, I don't think you want me to be your doctor. Probably not a good plan. I've had a role change since our last meeting. I am now the judge of County Criminal Court at Law Number 1 here in Denton. And my replacement up in the probate court is one of our longtime patient advocates for mental health. So we have a new opportunity to start working on our 1622 diversions. And we moved our first defendant/patient into what we hope will be our pilot program for that earlier this week, actually yesterday, with some pretty intense coordination between the DA's office and the probate court and our MHMR department and local hospital to get that done. So we're excited to see if we can continue that based on the success of our first candidate. I'm incredibly interested in stealing one of your community diversion coordinator pilot programs. So Christy, you'll be getting an application for that once those come out. And I would especially like to thank Justice Bland for coming up to Denton on April 1st and swearing me in the office. So with that, I'm done.
Thank you. Now the Honorable Oscar Kazin.
Thanks, Judge. I've known you long enough that I can always remember your last name. But this is only my second meeting. Thank you for inviting me. I intend to reach out to Justice Boyce, Judge Carr, and Judge Specia promptly on Monday. I think it's time for me to join committees. I wanted to get two meetings under my belt before I jumped in, and hopefully I can help. Have a great weekend, everyone.
Thank you. Now, Dr. Andy Keller.
Hey, Judge, this is John Petrola. Andy had to step off. He asked me to, and I did link testimony he's been asked to provide to a U.S. Senate committee next Tuesday on the impact of COVID. He wanted me to link that primarily because, as folks on this call know, the sort of accelerating impact of COVID on mental health, something likely to be felt by virtually everyone on this call over the next 12 to 18 to 24 months. So for those interested, the link is in the chat. And we're going to also be participating on the long-term committee and the data committee. So thanks so much.
Thank you very much. Now, Adrienne Kennedy.
Thank you, Judge Hervey. I really appreciate it. I think one of the most important starts for me for the day was your comment about the fact that there are no stupid ideas, because actually what happens for me as I sit in these meetings is to really understand, you know, the new series of ideas that pop up for me as I hear people's testimony and updates. I want you to know that one of the big pieces that I've been working on as an immediate past president of NAMI National is actually the Criminal Justice Study Group. And we've had some great people who testified and making presentations. Dr. Jenny Simpson was one of them. John Petrola will be another one. And some of you I'm going to be reaching out to, because I believe, for instance, it's very important for us to look at the range of opportunities and possibilities here. I think that trauma-informed everything we can think of with trauma-informed development is incredibly important. I really appreciated very much Sean Grove's presentation and also Chief Stanbridge. So I'll be reaching out to both of them. I do want to participate. I've already signed up for one committee, but a couple of others coming to mind. I think what we see here is that we think globally, but act locally. And overall, the importance of this commission is the fact that we get these large spans of information sharing that really trigger great opportunities and ideas for how we can interrelate. I want you to know that one of the things I've been really advancing in my own space and in the NAMI space is stress management for first responders. And one of the things that I've come on to is Heart 911, developed by one of the first responders of the Port Authority on 9/11. And he's worked with Dr. Frashone of Yale and also Mass General, and also with Dr. Southwick, Scott Southwick, who wrote the book Resilience around trauma-informed stress management for first responders and all others, and also a lot of resiliency training. And I think that's what we need across these spaces. I'm very pleased with everything I heard about the importance that people are seeing in ACEs, you know, adverse childhood experiences, and all this informs our work at NAMI. I want you to know that I say Texas Judicial Commission over and over and over again around my NAMI colleagues locally and nationally. And this work is very important. I think the spin-off effect of what we're doing here in Texas is incredibly, incredibly powerful. And I thank you for the opportunity to sit with you all and learn some more. Thank you, Judge Hervey. Appreciate it.
Thank you very much. Now we'll hear from the Honorable Sue Carita.
Good morning from El Paso, Texas. I'm a county court at law judge, and I'm just happy to be here, happy to serve again, and looking forward to working on the subcommittee. So good morning.
Good morning. Beth Lawson.
Hi, good morning, everyone. Thank you for such a great meeting. I really like the format of having the organization agency-based reports. I think that's extremely helpful. As an LMHA, I think you would expect that we are hot and heavy in providing information and education for the legislative session. But as Commissioner Gaines and Commissioner Maples mentioned, we are also hot and heavy in the middle of pivoting with the 1115 recension and are looking to see what that actually means and what we're going to be able to do going forward. It is quite catastrophic to our system, but I have full faith that our partners, both at the state level and the federal level, will work to ensure that people with serious mental illness are not also devastated. So thank you.
Thank you. Major Mike Lee. Nope. Okay. The Honorable Elizabeth Leonard.
Oh, there we go. Good morning, and thank you, Judge Harvey. I look forward to working on committees, and today I was supposed to be at a trauma-informed conference that the Texas Center for the Judiciary is putting on. I don't know. I know they're going to put it online in 2 weeks, so I don't know if we can open up that link or not. So it's free education for judges. So that's great. And, you know, I watched a movie several years ago called Paper Tigers. I don't know if any of y'all have heard of that. It explains ACEs if you're kind of wondering about all of that. There's some boundary issues. I mean, I'm not a real big advocate, you know, that this is what we need to do, but it's kind of some good background if people are interested. It's called Paper Tigers.
Thank you. The Honorable Pam Liston.
Good morning, and I'm so glad to be here with you all. I had the opportunity to testify on House Bill 4486 as the president of the Texas Municipal Courts Association on Monday. I did that along with collaborative council member Judge Kirk Noacre, who's the chief magistrate for Burnett County, and we were just thrilled to get to participate in that way, and we are big fans of this commission. I'm glad to be here. Thank you.
Thank you. Dr. Martinez, I understand, had to step away for another mental health meeting. So now we'll hear from the Honorable Stacey Matthews. No? Okay, Beth Mitchell.
Good morning. Don't really have much to add. Appreciate being back on the committee again and hearing all the information from the stakeholders. It's good to hear that there is a lot more money being put into the system. I'm just hoping that we make sure we don't build more facilities just to dump more people in, and instead we use the money more smartly and ensure that we get more community-based services.
Thank you. The Honorable Nathaniel.
Can I just jump in for one
Sure.
second, Judge? Beth Mitchell was just recently honored at the Texas Access to Justice Foundation Gala, which was virtual this year, for her outstanding work as a lawyer in the pro bono space, in particular, her dedication to Disability Rights Texas. And she gave a very moving acceptance speech, which was nothing about her, but about the important work that she does. And I just thought this commission would want to be aware of her recognition.
Absolutely, and congratulations.
Thank you, Judge Brown.
The Honorable Nathaniel Moran.
Good morning, everyone. I'm Nathaniel Moran. By way of introduction, I'm the county judge in Smith County. I'm brand new to this commission, and this is my first meeting. It's been a pleasure to sit through this meeting. I look forward to building relationships with each of you. I've been the county judge here in Smith County for about 5 years, and believe I only know one of you on this call, and that would be Brian Shannon, a former law school professor of mine, and his name was all I needed to know be able to know this was a great commission. So looking forward to meeting all of you and working on a committee and doing some good in the area of mental health. Thank you so much.
Thank you. Judge Needles had to step away, so we will now hear from the Honorable Roxanne Nelson.
Good morning, everyone, and thank you so very much for allowing me to serve for another term on this very important commission. And I look forward to adding that rural perspective again for the next 2 years. And as Judge Liston mentioned, she and Judge Noaker did testify on a very important piece of legislation that would affect Article 1622 and expand our allow us to continue to serve those who are brought to the jail on Class C misdemeanors. A couple legislative sessions ago, they were eliminated from that. And although we don't like bringing Class C misdemeanants who are in a mental health crisis to the jail, it does happen, especially in rural counties, because sometimes that is the safest location to bring them because we don't have hospitals or resources for them. And so that testimony that they gave was very important to make sure that as magistrates, we can do the job of trying to get them the help that they need. So thank you, Judge Liston. Thank you, Judge Noaker. And thank you for allowing me to be on the commission again. I appreciate y'all.
Thank you. Denise Onken? Okay. Lee Pearson?
Good morning, everybody. Thank you for all the great information this morning. I just have a brief update for you on the Dallas Deflection Center. One of the pieces that we had been kind of wondering where we were going to get funding for was the security for the Deflection Center. And we found out just about 2 or 3 weeks ago that Mark Cuban and the Mavericks are going to sponsor the first 2 years. So that was a huge piece and the next big step forward for our deflection. So we're excited about that.
Wonderful. James Rasmussen?
Judge, thank you very much for an informative meeting, and I don't have anything to add, but I would extend thanks to the staff for preparing the meeting materials. They're very helpful to get them in advance so we can review them, and I know they put a lot of work into those, and so if you would thank them for us, I would appreciate that. That's it.
Thank you. Judge Renee Rodriguez-Bencourt?
Good morning, everyone. Again, I'm extremely honored to be serving on this committee and this commission. Recently, I just returned from Galveston. I attended the Texas Association of Specialty Courts in preparation for starting up the first ever Hidalgo County female juvenile mental health court. So this is my second meeting. I'm learning so much, and I just can't wait to be part of those committees hopefully with Judge Wheelis in expanding and obtaining more practice, more training for judges, especially juvenile judges in regards to mental health and looking. And I also want to say thank you for the updates from Mr. Grove and Ms. Zamora in regards to some of those matters that really do affect the juvenile system and with regards to mental health. So thank you again.
Thank you. Professor Shannon.
Thanks, Judge. Under the adage of all politics are local, here in Lubbock County, we've had a good opportunity with collaboration by a number of our public entities, city, county, Star Care, hospital district, university, medical school, to come together, funded a Meadows needs assessment, which then has helped set the table for some work we're now trying to do to improve our emergency crisis response and help get out of silos, but work better together as a community. So excited about that.
Thank you. Shelley Smith?
Good morning. It's good to be here again. This is my second meeting, and I'm still very honored to be asked to serve on this commission. One of the things that we do is we serve a 23 county rural area. So I was very pleased to hear all the information on the juvenile side. So I'm just excited to be here and say good morning to everyone.
Thank you. Judge Stevens.
Good morning. Thank you, Judge Hervey and Judge Justice Bland. I do appreciate the opportunity to serve, and I look forward to working with several of y'all on the committees. That's all I have. Thank you.
Thank you. Brandon Wood.
Thank you, Judge. I really don't have anything to add. I will have an update and for the next meeting. I know that we have quite a bit going on, as does everyone else, and there's quite a bit moving through the legislature. So rather anxious to see what it looks like on the other side.
Okay, and last but not least, Wayne Young.
Good morning. I was eyeing April Zamora's name there, and I was hoping she might be able to give an update so I wouldn't be last. So I appreciate the opportunity. I'm like many others. This is my second meeting, and I'm grateful for the opportunity to serve with all of you. Just a quick heads up that the Harris County Sheriff's Office and the Harris Center received an excellence award from the National Council on Behavioral Health for our core program, which is where we've placed a couple of hundred tablets in HCSO and constables' cars so that they can connect with a mental health clinician remotely when they are dispatched to a scene that requires perhaps a little bit of mental health expertise and support. So we're proud of that acknowledgement and the hard work of our teams who made that happen over the last couple of years. That's all the update I have. Thank you very much, Judge.
Well, congratulations. And there were no submissions from the Collaborative Council for as far as announcements. So please, if you would, send those in before the next commission meeting or during the May 4th Collaborative Council call, please. Thank you. Just as planned.
There being no further business, as I understand it, we're going to adjourn a few minutes early today. And I just want to say that Judge Hervey and I are grateful for the work of our Executive Director, Christy Taylor. And someone mentioned the meeting materials. She and her staff worked very hard to make this a meaningful use of your time. We know that you make a commitment to be here among a lot of other priorities. And so thank you for joining us today. We look forward to seeing you at our August meeting, which we hope may be in person, but you'll have to bear with us. We'll make that call closer to game time, and we will be sure to let you know far enough in advance that you can make arrangements. We would really enjoy seeing all of you in person, and I know you'd enjoy seeing each other. So if it works, we're going to keep our fingers crossed. If not, we'll see you on the Zoom at our next meeting. Take care, and thank you for all that you do.
And I also thank all of you, and I look forward to our meeting in August, and I hope that we meet in person. And if we can't, I hope to see some imaginative faces, or if we meet in person and we have to have masks, I hope they're entertaining. And if we can meet without the mask, that will be good. And if we have to meet by Zoom, well, we will, but we'll get there one of these days. So thank you for your continued support of the commission, and please send in your ideas, your thoughts, your help, and have a good rest of your day. Stay safe.
Thank you.